Good afternoon, I'm Sean Yao and this is One News Now. The threat of a post-holiday surge in COVID-19 cases looms as people are expected to move around more. For the details, Greg Gregorio joins us live from Mandaluyong City. Hi, Greg. What are our health experts saying about moving around during the holidays, connecting or in the context of COVID-19 increasing?
Yes, Sean, the health department says they are now seeing an increase in the number of COVID-19 cases, particularly in Metro Manila. In a media forum earlier today, Undersecretary Maria Rosario Vergeire has confirmed that the reproduction rate of the virus is now above 1. This means that more people in NCR are now being infected as compared to the previous months when we were at below 1 infection threshold. Vergeire attributes this to the increased mobility of the public during the holiday season, coupled with poor compliance to health protocols. Dr. Antonio Dans of Healthcare Professionals Alliance Against COVID-19, or HPAC, has also revealed that some hospitals are now seeing an uptick in the number of individuals seeking emergency care. The DOH meanwhile reported that the current hospital occupancy rate for COVID-19 patients across the country remains at low-risk level. But they are already reminding the hospitals about the mandated 20 to 30% allocation of beds for COVID-19 patients. They also insisted that the COVID-19 situation in the country is no longer an issue of what age group could be allowed to go out of their households. With the signal that a surge may happen soon, everyone, no matter how old, should stay at home if they have no necessary errands, according to the experts. The UP Octa research team has warned that daily cases in the capital region could go as high as 4,000 by the end of January. Let's hear more from the group.
4,000 is actually a very critical number because last time we went to MECQ, we were at 2,000 cases per day in Metro Manila. So we don't want to reach that level, obviously.
Sean, President Duterte meanwhile has urged Filipinos to follow health protocols to avoid the post-holiday surge of COVID-19 cases. Health Chief Francisco Duque III has also reminded the public to avoid enclosed and crowded areas. He also discouraged holding and participating in salo-salo or buffets and using torotots or trumpets. Sean?
Thank you for that update. Greg Gregorio joining us live from Mandaluyong City. Health Secretary Francisco Duque III finds himself in the hot seat once again, this time over his supposed negligence that led to the failed vaccine supply deal with Pfizer. But as before, Malacanang says the health chief still has the president's confidence. Greg Gregorio is back with the story.
Some senators are now blaming Health Secretary Francisco Duque III for supposedly failing to secure early supplies from vaccine frontrunner Pfizer. Senator Panfilo Lacson has revealed that it was the health chief who dropped the ball and the opportunity of early vaccines went to Singapore instead. The lawmaker says U.S. Ambassador Babe Romualdez and U.S. Secretary of State Mike Pompeo have already been in talks since July. The deal would have given the Philippines 10 million doses. Failed to provide the necessary date agreement for this negotiation. With this, Senator Kiko Pangilinan speculated that a kickback or corruption might be involved in the vaccine deal. He adds that if someone failed to act and led to an injury to the government, a section of the anti-graft law will be applied to them. For Senate President Tito Soto, the president's sentiments on the Toll Regulatory Board on the RFID mess are also appropriate for Duque. Secretary Duque, who was present in a health forum this morning, did not discuss anything related to the controversial vaccine procurement. But in a statement,